signs and how to detect if you're actually headed that way and change course so that you don't create this kind of problem for yourself. So I'm going to first tell you that I'm a physical therapist, not a doctor. If you are having a serious problem and it's not going away and you're worried about it and it just doesn't feel right, and the simple things like rest and anti-inflammatories and ice and avoiding your painful activity don't relieve your problem, then I do want you to see a doctor and not rely on everything that I say to be the be-all, end-all to solve your aches and pains. So, there you have it. Yes?
Interjectively say, I would recommend a sports doctor rather than an orthopedic doctor, because if you go to an orthopedic doctor, they'll do surgery on you probably, and they're going to tell you. I've had bad problems with orthopedic doctors.
Well, an orthopedic sports doctor.
Yeah.
An orthopedist who sees mainly athletes, who has that mentality. And then when you do see a physical therapist, then you also see a physical therapist who knows your sport and knows your lifestyle as well. Because you know, if you see a physical therapist that doesn't really understand the demands of your sport and you know what your normal training is really like, they can't really relate to what your needs are and how to best get you to your final goal, which is to be pain-free and to be doing what you want to do as much as you want to do it and be as fast as possible, which I think is everyone's goal, to really excel at your sport without pain, right?
Yes.
Okay, so there are a lot of injuries that we could talk about, but I've decided that we should talk about overuse injuries like shoulder pain, which normally will cover things like rotator cuff tendonitis, impingement syndromes, tendonitis of any structures in the shoulder. Also talking about knee pain, not talking about ligament tears, meniscus tears. I mean, that's, you know, you've already gone past a little bit of the overuse. I'm talking about chondromalacia, patellar tendonitis, that kind of knee pain. When you have internal derangement like a meniscus tear or a ligament tear, you know, that's when you've got to start doing some serious diagnostic testing. I've got to really look at what structure's involved and then take the right course of treatment after that. Sometimes it is operative, sometimes it's conservative care, but you know, you need to know for sure what is going on inside. And then the last diagnosis we're going to talk about is back pain. Not necessarily lower back, could be upper back, neck pain, mid-back pain. Not talking about blown out herniated discs with numbness down the leg and loss of reflexes or loss of bowel and bladder control. That stuff, you're going to the doctor. Talking about an achy back, a stiff back, it doesn't feel good when you wake up, after you're up for a little while, pain goes away, or if maybe you start your run for 5 minutes, you feel it, after 5 minutes you don't feel it, that's the kind of back pain I'm talking about. Okay, so let's start with the shoulder. So a little bit of stuff we're going to talk about. We went over doing some of the exercises. I want to explain a little bit about anatomy first. So the shoulder is really a complex. It's not just like a joint. You want to think about the bones of the shoulder, including the scapula, the clavicle, and the humerus that this poor guy lost because he had a very unstable shoulder. So this is a right shoulder. So it's a ball and socket joint, but it's a really bad ball and socket joint because the socket's really flat and the ball is pretty big. So that's why we have such like amazing range of motion. Otherwise, it wouldn't work that way. So the problem is that your humerus, your upper arm bone, is basically hanging from your shoulder joint. It's not really so firmly attached as other joints in your body. And it's hanging from like this arch here, which is part of your scapula and clavicle, which is also controlled by muscles that are attaching to your trunk. So if you don't have proper posture and you don't have proper muscular balance of all the muscles that attach to the scapula, then your shoulder joint, your humerus attaches, is really predisposed to injury, weakness, and not optimal performance. So when I look at a patient or an athlete with just a little bit of vague shoulder pain, I like to look at how their shoulder blades sit on their body. You can tell a lot from that because if you have very tight and short cervical muscles and you have long and relatively weak mid-back muscles like your lower trapezius muscles, middle trapezius muscles, to even your serratus muscles. They attach to the lower half of your scapula. Then your scapula is going to start to kind of like come up and away. So if you're looking at this guy's back, so then his scapula is going to start to glide out like that. So we have to try to like fix that. We have to. That's the common scenario that we see: tight and short upper muscles here, and then long and weak lower muscles on the shoulder blade there, as well as weaker rotator cuff muscles. So some of the exercises that we did back there on the ball, pulling the cables that way, on the ball, rotating this way, were really to try to strengthen those lower trap muscles. And I always try to make everyone get cued into a long neck, so you're not hyperextending. You want to keep that space and tuck that chin. We don't want to overuse our upper trapezius muscles. Does that make sense to you guys? And I think that I might have done this with both groups. I'm not really sure. Why doesn't everyone stand up and get into a slouchy position? So you'll see that when you do that, your scapula rolls forward. It's going to make that acromion arch come forward. I try to raise my arms all the way up, and I can't get there. But if I straighten out, I can then continue another maybe 30 degrees even. Yes. So for all the time that you spend swimming and biking and at your desk or at your computer, you're allowing these anterior muscles and your cervical muscles to shorten. You're lengthening the lower trapezius muscles, and it's really important that you do something to counterbalance that. Okay? You guys have questions about that so far or not? The other thing is if you let your scapula tilt forward that way, the rotator cuff passes through this acromion arch here. That space is going to get shortened. Less room for those tendons to pass, and every time you're taking a stroke and you're swimming, you're pressing down on them. Over time, they can get irritated, then they start to thicken, they get inflamed, and the whole cycle is very hard to interrupt. So you want to stop that vicious cycle from ever starting. Okay? Got it? Does anyone experience pain? Like, not you, but like you do. There's some of the signs that you may have some early changes going on for tendonitis of your rotator cuff, impingement syndrome, would be a painful arc on the way down. So if you go up through forward flexion, turn your palms out, and slowly lower your arms down, there's a region around here where some people with rotator cuff tendonitis and impingement will feel some pain. And then they get down to the bottom and they're like, oh, it feels better. Like they go up, they come down, they go, oh, it hurts a little bit, oh, and then it feels better. So, you know, if something like that is going on, you may really want to pay some attention to the muscular balance around your shoulder complex. Okay?
My shoulders up.
Well, you didn't do the strength training today with me, am I off the hook? All right, moving on. You know, other signs of something that may be going on is if you have a little bit of pain radiating down the arm, even some muscle atrophy. You want someone to take a good look at your back. The muscles that fill in the hollows of the shoulder blade should be nice and full. If you have pain in one shoulder and not the other, and someone looks at your back and they see that one shoulder blade looks a little hollow compared to the other, you don't have a good muscle mass there, you may want to start really addressing your rotator cuff strength and correct your posture and call me. I have some exercises listed here for corrective exercises. You almost want to think about it as like if your tires aren't balanced on your car and you have and if your muscles aren't balanced around your shoulder, you're going to have uneven wear and tear. So if you're doing a sport like triathlon, where it's a very repetitive thing, the number of times you stroke when you're going for a 3,000 meter swim is pretty ridiculous. So if you couple that with some muscle imbalance and postural problems and going to school, if you don't do something to reverse all that, it could be trouble. And that's the last thing you want, because then your training is really going to be cut short and your performance. So one thing that, I don't know, John, when you did stuff on the roll, did you do anything like supine, like postural stretches on here?
Yeah, that's some
Like
thoracic extension.
SARM and stuff? Okay, so they're listed on here. The other thing, obviously, is make sure that your stroke is good. So I'm not here to teach you guys about swimming. but you know, you want to make sure that you have that rotation, that you're not taking your arm out too wide, because it's just too much, the lever arm is too long, you want to bring that hand in closer. And if you're having problems with your stroke, then definitely make sure you get that checked out by someone who really knows what they're doing and make the corrections, because only perfect practice makes perfect. The more you swim with bad form, the more it gets ingrained in your motor patterns, and it's harder to change, so make sure it's right. Okay, moving down to the knee. Well, any questions about the shoulder? Good. Okay, also, good arrow position is important too. You want to make sure that your bike fit is just right. Otherwise, you can really irritate your shoulder. If you're too low, I mean, usually they say 1 to 4 inches difference in height from the nose of the saddle to the arrow bars. Your elbows should not be too far forward. It should be right below your shoulder, so get that checked out too. Okay, the knee. Anyone have knee pain?
You mean like runner's knee?
What's runner's knee?
Just a general soreness, I guess.
Yeah.
I used to have it a lot.
What did you do for it?
I had a lot of foam rolling.
Yeah.
Even,
Got better?
really bad.
Right.
Sometimes you get some pain on the outside.
Yeah, that's a similar type of ITV. Right. So you want to think about the anatomy of the knee now. This is also another very injured knee. This poor guy. He ruptured his patellar tendon. He's really due for some surgery. So it's bad. This is right knee. These are old. So your quadriceps come down and they form your quadriceps tendon, which then encases your patellar. And then comes down to your patellar tendon and attaches to your tibia. So there are some intrinsic factors that may be hard to change, may make you a little more vulnerable for knee pain. Some people may have a much smaller patella than others. Obviously, I have a smaller patella than, say, John, because he's so much bigger than I am, but even comparing same size people, if you have a smaller patella, you're going to have more stress. The size of your patella, you distribute the force. So if you have a very small patella, then you may have some more wear and tear on the surface of the kneecap, which is called chondromalacia. It's a pretty common generic knee pain problem. You want to think about how tight this quadricep muscle is. It should not be too tight, because that is going to cause a little more compression into the joint. So we showed you some quad stretches today. The other thing is to stretch your glutes. Your glutes and your hip flexor come together, form the ITV, which comes down and attaches to the outside of the knee.